Okay, I'll skip this. So, two concepts. One is that late onset depression as a prodrome state of dementia. So, this is a study that shows that the shorter the duration between the late onset depression and the AD onset is associated with an increased risk of dementia. And this is mediated by the this E4 allele. So in other words, this suggests, the evidence here suggests that depression can be prodrome symptoms of dementia. Okay, so one concept is that depression is a prodromal aspect of dementia. So you develop depression and a few years later you're going to develop dementia. The other one is risk factors, late onset depression being a risk factors, and therefore that can happen many, many years later. And if you have depression, and you probably will be at increased risk of developing dementia, even 5, 10, 15, or in the case of the Framingham studies, over 17 years of follow-up compared to those who were not depressed at the beginning of the study. I won't talk very much about management because we also have covered quite a lot, except to say that I'm not sure about Abelia. I hardly use TCAs these days because I think there are some studies that shows that they are equally efficacious compared to SSRIs and TCAs, although there's been also some report that TCAs can be used or more efficacious for those who are very severely depressed, who have not responded to your SSRIs and one other group of medication. And if you were to use TCAs, I think you should probably preferably use things like nortriptyline or desipramine, which you don't have. So I use very low dose nortriptyline for some of my patients, but again, you have to be careful about all the possible side effects when you have to do your ECGs. This is just to show you that paroxetine and imipramine equally good in terms of efficacy. Tolerability, I think that the one you are aware of it. So this one, okay, you know. I think I can skip this, right? Yes. This one you know, I don't have to belabor this. I think ECT, ECT can be accepted. Generally, is safe. I think the issue of whether they have cognitive problem as a result. Now, the studies have shown that actually short term, within the first 6 months post-ECT, they may have some cognitive difficulties, but they tend to be transient. In fact, some studies have shown that after their mood improved with ECT treatment, their memory actually improved. So the cognitive performance actually improved rather than deteriorate after the ECT. But immediately, the first few months post-treatment, some of them may have some cognitive problems, but they tend to be transient. Just a quick few slides on psychotherapy. I think right now, as far as evidence-based is concerned, it's still mainly CBT. Although IPT and psychodynamic therapy has been used and reported, but there is really no single dominant form of psychotherapy. Probably most people would use CBT. So this is what we have at this point in time. The CBT is from an evidence-based one, be an efficacious treatment for late life depression. So there are some of the studies that have been reported. Individual therapy is probably better, well, at least there are more evidence compared to group, and it's not easy to have group therapy. And there's been some studies that shows that psychotherapy is just as efficacious as medications. Well, these are just some of the reports. I think I won't go into it. Now, prognosis, I think you know that there's always reported in terms of high chronicity and mortality compared to younger people. But a significant proportion of them can achieve lasting recovery if you maintain them on the treatment. The poor prognostic factors in terms of outcome will be things like cognitive impairment, if they have physical illness, and if the depression is severe. Okay, I think that's all I have.
I've got one question. For regards to depression, the link between depression and dementia, is there any evidence to say that treatment of late onset depression will reduce dementia later on in that treated pool? Do we have?
No, not that I know of, unfortunately. That if you treat your depression, you can then prevent the dementia. I'm not aware of any such intervention studies.
It suggests that it doesn't prevent dementia.
A bit depressing. Okay. Are there any questions from the floor?